Pharma Diaries. Here, I will attempt to make sense of some of the prescription medicine commercials that they bombard us with every single day in this new age of streaming services. If you're like me, you've learned long before COVID about Big Pharma and its hold on the medical profession. I can absolutely admit that SSRIs saved my life in the short term while dealing with severe PTSD and a brain injury. What I didn't know, but I'm sure my doctors did, was that these fucking drugs were not meant for lifelong treatment. Now, I'm going on 20 years, and although I've been able to kick one of the two I had been prescribed in that time, I don't see any way in kicking the other. I did get the worst of the two out of my system, but my brain is completely rewired and fucked now. I tried to quit the second, but every time, usually around 3 days into the weaning, I go completely berserk. But at least this one doesn't make me fucking lethargic and zombie like the other did. Quitting that one literally turned me into a legit cornholio. So, without further ado, let's get into our first one.
Despite being on an antidepressant, I was still masking my depression symptoms.
My doctor said it could be because my antidepressant alone wasn't enough, so she recommended an add-on treatment. She recommended adding Rexulti.
When taken with an antidepressant, Rexulti was proven to significantly reduce depression symptoms, more than an antidepressant alone.
So with my antidepressant, Rexulti could provide a boost.
Elderly people with dementia-related psychosis have increased risk of death or stroke.
Right off the bat, the first warning is fucking death? Are you people serious? Don't answer that, Rexulti. Let's continue.
Antidepressants may increase suicidal thoughts and actions and worsen depression in children and young adults. Call your healthcare provider right away to report new or sudden changes in mood, behavior, thoughts, or feelings, or if you develop suicidal thoughts or actions.
Sorry, I can't go any further. So while your first antidepressant, which you probably shouldn't be on, or in my case, were prescribed over the recommended safe dose, isn't working, you should add another? Like, if the first one isn't fucking working, you need to turn inward, reevaluate your entire life and system, single out the cause, and attack it. Adding another with a warning that if this one doesn't work, you're more than likely going to fucking kill yourself. Huh? How weak do you have to be to even try this shit? Pills solve nothing, folks. Again, the first SSRI did give me the boost I needed, but as soon as I came out of the brain injury, maybe 2 to 3 years later, I could have and should have turned inward for the PTSD. But I was lazy. If any fucking antidepressant could possibly make you remotely suicidal, that's your first clue, Sherlock, not to go anywhere near it because you already are suicidal. That's the complete opposite of what you're looking for, right? How about this next one?
COPD is an ugly reality.
Do you have his medical history?
I watch as this world just keeps getting smaller. But then, Trelegy helped us see things a little differently. With 3 medicines and 1 inhaler, Trelegy keeps airways open for a full 24 hours and prevents future flare-ups. Once daily Trelegy also improves lung function, so he can breathe more freely all day and night.
Trelegy won't replace a rescue inhaler for sudden breathing problems. Tell your doctor if you have a heart condition or high blood pressure before taking it. Do not take Trelegy more than prescribed. Trelegy may increase your risk of thrush, pneumonia, and osteoporosis.
Trelegy may increase your risk of pneumonia. So let me get this straight. They want you to take a med to help fix your lungs that may give you a much worse lung condition that sometimes, depending on age, could fucking kill you? How retarded do you have to be to take something like that? There's gotta be a better way, no? But also, what is thrush? I never even heard of it, so let's look it up. Thrush is a fungal infection caused by yeast, commonly appearing as creamy white painful cottage cheese like patches on the tongue, inner cheeks, and throat that requires another pill to fix. Cottage cheese? So you may have whitehead pimples popping inside your fucking mouth? No thank you, Trelegy. Suck it. We're doing good on time, so let's get one more in.
Cut. Jardiance plays a role in my story, too. I have type 2 diabetes, but I manage it well with Jardiance, a once-daily pill that helps lower my A1C. It works 24/7 in the body to flush out some sugar.
And for adults with type 2 diabetes and known heart disease, Jardians can lower the risk of cardiovascular death, too.
Serious side effects include increased ketones in blood or urine and infection between and around the anus and genitals. Both may be fatal. Severe allergic reactions, dehydration, urinary tract or genital yeast infections in men and women, and low blood sugar. Stop taking and tell your doctor right away if you have nausea, vomiting, stomach pain, tiredness, rash, swelling, trouble breathing or swallowing. Tell your doctor about lightheadedness, weakness, fever, pain, tenderness, redness, or swelling between the anus and genitals.
What the ever-loving fuck, dude. Blisters on your balloon knot that are so bad they could fucking kill you? I've dealt with a hemorrhoid or two, and I was a homicide detective, and I don't think I can imagine a death so fucking horrific. Seriously, is eating cheesecake and Skittles with every fucking meal that important to you that you would risk a pill creating a dragon fire, eating your entire body from butthole to brain and killing you? Well, if so, fuck off and take your Jardians. I will not mourn for you. And that, folks, is the premiere segment of the Big Pharma Diaries.
Get him, Jay. I'm not a cop.
You got DP'd.